Are you overwhelmed caring for an aging loved one? Whether you're an adult child, spouse, partner, friend, or a professional caregiver, then this podcast is for you. Welcome to your Silver Lining. Each week, we bring you valuable content to help you provide the best care and support possible, along with tips on how to care for yourself. Your Silver Lining hosts will cover topics such as recognizing when a loved one needs help, advocating for them in the emergency room, managing medications, maintaining fluid and nutritional balance, handling acute and chronic diseases, and much more. And now for the disclaimer. Keep in mind the information you are about to hear should not be misconstrued as medical or legal advice. See the full disclaimer below. And now on to the show with your hosts, Stephanie and Paige.
Hi there and welcome back. My name is Stephanie Cameron and I'm your nurse care manager. I'm also the owner and founder of Transitions Care Management. We're a concierge care management practice here in the Seattle area. And I am here with my awesome co-host, Paige, who is also our operations manager.
Welcome.
We're super excited about today's episode. We're going to be talking about emergency room etiquette. However, I want to tell you that this episode is going to be done in the voice of somebody who is advocating for a loved one. Many different people have experiences in the emergency room, whether you go in by yourself or with a loved one. And we really want to speak to how you can make your experience better while you're advocating for your loved one in the emergency room.
And this is an overview of the emergency rooms and why understanding ER etiquette is so critical. What to expect during an ER visit and how to navigate common frustrations.
So let's dive right in.
Let's do this. So my first question for you, Stephanie, is what does a caregiver need to consider before taking their loved one to the ER?
Yeah, so being an advocate for your loved one, you have a little bit of an advantage. You can prepare for that ER visit, right? So a little preparation is going to make your visit go much easier. So we start with an emergency packet.
And what does that look like?
So an emergency packet, and I've got quite a list of things, so I'm going to be reading from my list, would be things like an ID card, an insurance card, emergency contact information, legal documents, which might include advance directives and power of attorney documents. And that's both for power of attorney for healthcare and for finances. Sometimes they're different. A document of key essential information. We'll put a link below for this. Now, that would include special considerations and just good things to know, like do they wear glasses or contacts? Do they have hearing aids? Does your loved one wear dentures or any other removable oral devices? Do they have pacemakers, which you want to make sure you're including information about that pacemaker. We're putting a link below from the American Heart Association on a great document that allows you to put all the information that somebody in the emergency room would need to know if you have one. The list would also include any metal that might be on the body. If your loved one needs to get an MRI, they're going to want to know that. Medications and allergies, list of diagnoses, surgical history, their fall risk, if they use any assistive devices, and what their ambulatory status is.
So it's really kind of preparing for all those questions that they're going to ask you. And instead of fumbling around, you'd have a packet.
Yeah, exactly. It has saved so much frustration and also allowed the doctors that we work with and the nurses we work with to provide a more accurate diagnosis and care plan, right? When they've got all the information right there. So now that you're ready, right? You've got your list, you've got your packet, and you're ready to go to the ER. So let's discuss what you can and can't expect from the ER.
So imagine we're in the ER. Let's walk through step by step, caring for your loved one. And my first question on that level is, why are the wait times so long?
Oh gosh, and getting longer, and they get frustrating. So it's because of triage, honestly, and it's not a pick a number. Number 3 goes and, gets called back at the third person. It is based on medical need. And so a patient arriving with severe trauma, like a gunshot wound or a heart attack, is going to go back before somebody who has a sprained ankle, right? Or had a minor fall, but they're not in deep pain. So the ERs, they have to focus on the more critical need patients, even though it can be frustrated if they have a lot of those and you're waiting a long time. In order to save lives, this is why they have that system. And they actually have a system, right? So it's a 5-level emergency severity index. It's a 5-level triage system, and it categorizes people from a level 1, which is the most critical, see them now, to a level 5. You might have to wait extra time. And really the best thing you can do is have a little bit of patience during that time. It can be hard when they're that busy, but they do the best they can.
Patience and empathy go a long way.
For sure.
So back imagining here, while I'm here, can I get that rash on my butt looked at? Why do ER doctors only treat the condition that we come in for?
Yeah.
I mean, can we ask them to address multiple?
Oh, sure. You can ask. You can show me. Right? Are they going to address it? Maybe, maybe not. But that's not what the ERs are designed for, right? And this is part of the reason why we have these extended wait times, is because there are a number of people that will use emergency rooms as their primary provider and to really address a bunch of different issues. And so if you're advocating for your loved one, you likely have the primary provider. And so you really want to focus just on what you came in there for, which is what to operate optimally the emergency rooms are designed for.
And probably to help other people behind you that are waiting to get in.
That's right. Exactly.
Yeah.
Exactly.
So what are some of the common reasons for ER visits among the elderly?
Yeah, falls. Falls are number one. And because they're the leading cause of visits to the ER, we're going to be talking about fall prevention a lot. So we're not going to go into it in this episode, but I will tell you that we can give you the tools to help reduce the risk of those falls, which then reduces the chances of going to the ER. So, tune in, watch for episodes on fall prevention. There's some great information there.
Yeah, we did one, falls and fall prevention. Yeah.
So other reasons that somebody might go to the ER in an aging population are cardiovascular issues like heart attacks, arrhythmias, and strokes are most common. Respiratory infections all over the news for several years now between COVID, RSV, influenza, pneumonia. And then adverse drug reactions are right up there in the top reasons why our aging population is going to the ER.
Wow. Now, can we dive in and talk about some of the frustrations of the ER?
Absolutely. Let's do it.
The frustrations you experience as a patient are similar to the frustrations that the ER staff experience. They also don't like the wait times. They don't like the lack of beds, lack of coworkers, and that can create issues that aren't related to what you're coming in for.
Yeah.
So let's discuss how to enhance the ER experience. How can patients make their ER visit smoother?
Yeah. So going back to the waiting room, starting with that receptionist or the nurse in the triage area. They're doing their job. They're doing it based on a scale to get the most urgent people cared for. So understanding that and a little kindness and compassion go a long ways. Using the ER appropriately. If your condition isn't life-threatening, consider urgent care or call your primary doctor. Oftentimes they'll have an on-call person. With that said, if it goes to a big call center and you have a triage nurse, they might say go to the ER anyway, but it's worth a try. And if it's something that can wait till morning safely, maybe give your doctor a call. And then bring that emergency packet. You will learn to love that emergency packet. It's makes such a huge difference in your ER experience.
Also, when you're looking up the address or phone number for the hospital, there oftentimes are a little graph on when there's like a heavier trafficked time of day.
Yeah. That's
graph.
a great reminder. Yeah. I know some urgent cares will have that. And so it's always worth checking to see if the area hospital.
Yeah.
And if you have multiple hospitals in your area, and you need to go in, check
Check 'em.
websites and see if they have that meter.
Yeah.
Great. Yeah, great idea.
Absolutely. So let's recap some of the ER etiquette, understanding triage, knowing when to visit, and managing expectations.
Yeah, and I think by understanding that there actually is etiquette in the ER, which, by the way, I have to say, so I've had transitions care management for 9 years and have done care management for a number of years before that. And it wasn't until I'm really embarrassed to admit the past 6 years or so is when I learned that there was ER etiquette, because I thought I was being a good advocate by, hey, while we're in the ER, can you take a look at this? I thought I was being efficient, and come to find out I wasn't. So for you ER providers who I encountered during that time, I'm so sorry. We know better now, and we are teaching better.
That's why we're here doing this.
That's why we're here doing this. Learn from us. We've been through it. It's so yeah. So we're so happy that you joined us today, and hope that you got some good information from the podcast.
If you find it useful, please share, and with anyone who thinks that they need some etiquette in the ER. Comment below with questions or topics you would like us to cover in future episodes.
Yeah, absolutely. And like you said, like, share, subscribe, stay healthy, age well, and remember, we are your silver lining. And before we wrap up today, there are a few very special people we want to thank for their contribution in putting this podcast together. First of all, we want to thank Paige's awesome husband, Wade.
Thank you, Wade. Your velvety voice is part of our intro and outro, and we couldn't do it without you.
That's right. And next, I want to thank my daughter, Devin, for the logo design for the podcast and the merchandise. We're so excited to use it. It's so good. And next, my awesome friend, Jeff Leisawitz, for the music that he custom wrote just for us. And last but not least, and probably the best, is my awesome friend and co-host, Paige.
No, I want to thank my awesome friend and co-host, Stephanie.
Thank you so much for being here, and we'll see you next time. Bye.
Thank you for joining us on this episode of Your Silver Lining. We hope today's discussion was insightful and empowering. Aging isn't just about getting older, it's about embracing the journey and making the most of every stage of life. Through it all, we've got you. If you enjoyed this episode, please like, subscribe, and share it with anyone who might benefit. Your support helps us reach more people. Have a topic you'd love us to cover? Send us a message. Let's continue the conversation. Connect with us on social media or visit our website at yoursilverliningpodcast.com. Join us next time as we keep supporting you and caring for your loved ones. Until then, stay positive, be well, and remember, we are your silver lining.